Hi, this is Dr. Sean Delaney with Facial Plastic Surgery Associates in Houston, Texas. I'm a board-certified facial plastic surgeon, and I like to explain why smoking is a big no-no when it comes to plastic surgery. While the link between smoking and cancer risk and heart disease is common knowledge, the impact of tobacco use on our appearance and our ability to heal properly is surprisingly not well known. Tobacco, and specifically its active ingredient of nicotine, causes blood vessels to constrict. This applies to any nicotine-containing products such as cigarettes, vape pens, chewing tobacco, hookah, etc. For those who are considering facial plastic surgery, you need to be aware that smoking not only ages you prematurely, but also renders any kind of surgical treatment much less effective. The decreased blood flow from blood vessel constriction caused by nicotine also results in the accumulation of waste products that results in much less healthy skin that shows increased laxity, wrinkles, and thinning. And furthermore, for those who are using cigarettes, the repeated puckering action used when you smoke cigarettes can also lead to vertical wrinkles around the mouth, commonly known as smoker's lines. So why is smoking specifically a contraindication in plastic surgery? In many of the procedures that we perform as plastic surgeons, we make incisions in the skin and we must raise skin flaps, as in the case with rhinoplasties or with facelifts. And in doing so, we are interrupting some of the pre-existing blood supplies. And we must rely on the remaining blood supply to help the operated areas heal properly. And this may take a while until new blood vessels grow back, and they do, but it takes a while. Now, suppose someone is actively smoking or using nicotine-containing products and they undergo plastic surgery. In that case, the decreased blood flow caused by the nicotine may result in the surgical site not receiving enough blood flow. And as a result, it may not heal properly or can lead to delayed healing and potentially suboptimal outcomes. Furthermore, blood flow is very vital in preventing infection by carrying white blood cells and antibiotics necessary to fight off and remove the bacteria. So the risk of surgical site infection is much greater when there's less blood flow. And besides the surgical site, smoking is also bad for the lungs and really significantly increases the risk of getting pneumonia after surgery. Therefore, real and devastating wound healing issues can occur if someone undergoes surgery does not quit smoking before surgery. After surgery, it's also just as important to abstain from smoking during the early healing period where blood flow is important. Ideally, one should stop smoking completely. However, we recognize that it may not be feasible for every person to quit entirely. We therefore recommend that you stop smoking for at least a month before and a month after surgery for your best chances at getting a good outcome. Should you continue to smoke within this critical window, you are doing so at your own risk of increasing your chances of complications. In summary, if you are a smoker considering plastic surgery, this may be the necessary impetus to help you consider quitting. Non-smokers on the whole will enjoy better and longer-lasting surgical results and much faster recoveries with less complications. Besides the known health risks from smoking, tobacco use is bad for your appearance and increases your risk of surgical complications. Since you're already undergoing surgery to enhance your appearance, don't compromise your final results by continuing to smoke.